Alright, so I'm sitting here with a cup of coffee today, and I'm going to be sharing with you a little story time, a little experience that I've been going through that's been going on for the last year or so. The last thing I want to do is put out something, and this is why I've never said anything, because I don't want pity. I don't want anything like that. I just, we all go through trials and struggles, and that is just what life is supposed to be like. So I've never said anything really to anybody except like my immediate family and stuff, because again, I don't want any pity. I don't want anything like that, because I am fine. I am well, and I'm fine by the grace of God. But I am making this video because I don't usually put out personal stuff in general. It's usually just recipes and homemaking and homeschooling and stuff, but I definitely wanted to put this out because when I was going through whatever it was, doctor's appointments, all of these words thrown at you, all of these procedures and biopsies and different things like that, I want to know what I'm getting myself into. I want to know other people's experiences. I don't want to walk into something blindly. So that is why I am making this video, because I know when I was, when I was told that I had to do this biopsy and that biopsy, or, well, one biopsy in general, I went looking. I'm like, other people's experiences with either a breast tumor or other people's stories regarding it and their outcomes and different things like that. So it was helpful to me, and I'm hoping that this might be helpful to somebody either in the future or whatever. And also, another reason I'm making this is I thought about this because I was like, I don't even know if I should do a video on this, but after seeing all of those other videos, it really inspired me to, one, share my experience, so hopefully it helps somebody, and two, I want to selfishly keep this as a reminder to myself anytime I would see this, anytime I would see this video, this thumbnail or a comment or anything in whatever, and just have this there as a reminder to myself to not take a day for granted, take a good day for granted, take your health for granted, just the feeling of being able to exercise for granted. I have not really been able to exercise in months. I have barely been, I can't really walk far distances. That's why we really haven't gone anywhere or done anything for a long time, but I'm trying to just fight through it and just build strength and just ignore symptoms and all that kind of stuff. That's how I roll, okay? I have so many things on my plate. A lot of those things had to just be kicked off at some point. My daughter's Tamagotchi. I don't know what his problem is right now. Anyways, so let's just get into the video. We are how long? 3 minutes in, and I haven't even really started. But for the reasons why I wanted to make this, and I don't even know if I'll put it up, but if I do put it up, these are the reasons why. I just want to act a reminder for myself, and not only for myself, maybe for you even, and for my daughters even. Don't take your health for granted. There are days where I feel great, and I'm like, I feel like a human being again. Like, we just take the little things for granted. We take, and in general, I'm fine. In general, I'm fine. Everything else, I just try to push behind me, and I try not to think about it, and I just try to move on with my life, okay? This all started back at the beginning of the year. I'm going to go through a story time of how this all trickled down to be what it is, and at the end I will leave a timestamp down below for the biopsy, the core biopsy and the natal biopsy, which is what I really want to be talking about, my experience with those two, if anyone's going to go through those things. But also I do want to kind of give a little quick story, hopefully quick, because once I get started I just can't stop, of how this all started. So grab yourself a cup of coffee, a cup of tea or something. I'm having decaf today. This is so complicated because I don't like to get too personal, and I don't want to put too much in, but at the same time, it's what happened. So at the beginning of the year, I had ended up coming down with a rash on my left side here, on my right side actually. And I ignored it. I thought maybe it was a heat rash. So I changed clothing. I tried off. I wasn't sweating much. I mean, it was January. I don't think it was very hot at that time. January, February. My husband said, you know, try, maybe it's fungal. Try some antifungal. We tried some over-the-counter antifungal medicine, and then the rash went away. The next month, the rash came back, and it came back bigger. And I tried steroids, over-the-counter steroids. And I would use it like for a whole week. I would use the steroid or the fungal or however long I had to use it for. And it went away. It came back again. And every month it would keep coming back, and it would get bigger and bigger and bigger. And the pain and the intensity of this was not a regular rash. I was digging my skin, like I wanted to rip my skin out of myself. It was nonstop torture. Okay, it was a torturous rash. The itch was coming from like on the inside. It wasn't like on my skin. It wasn't really something topical. It was more of internally. And I finally made an appointment to go to the dermatologist, and they immediately, she saw it and she was like, we're gonna do a biopsy on this. I did, of course, read about inflammatory breast cancer, which is a rare, aggressive breast cancer. I did read about that. I tried all my homemade options that I can, and I did not want to jump into feeling that, okay, well, this is something without knowing really what it was. But this rash was not going away, and it was coming back with a vengeance all the time. Now, the one thing that was different with my rash compared to other IBC rashes, inflammatory breast cancer rashes, is mine would go and come and go, come and go. But everything was pretty much the same. The way how it looked, the pody orange, I believe is what they call it, like the dimpling of the skin, and everything pretty much looked the same in regards to it, but mine would just come and go. And every single month, this thing would show up, and it was torturous because it was like you wanted to dig your skin out. So I went to my dermatologist around May is when I would say I started to feel, we went to Disney World, and by the time we came back, that following week, we went on Saturday, and by Monday I was on the couch. I was on the couch for about a week. I had to take naps every single day, and I don't like to take naps. I'm not a napping person. I'd rather have a cup of coffee than a nap, but I could not function. Like, I just couldn't function. I wasn't sick. There wasn't a cold or anything like that, but I just could not function. I was very weak. My knees were aching, my elbows, my wrists, and I was having trouble walking up the stairs, and for like about that week. So I'm like, I gotta go. Then I felt like I had a UTI. Okay, so there was like symptoms on top of symptoms on top of symptoms, and I'm telling you, this is what I say: a normal day, when you feel like a whole human being, don't take that for granted. My gosh. I hope I don't. I hope that days when I feel like I can do stuff, let me do stuff, not just sit around. But anyways, I thought I had a UTI. I had a virtual appointment with my GP, and she ordered me some antibiotics, and I took those I took 3 out of the 10. And then when I had time, I went and did all my blood work and my samples. I did not have a UTI. I didn't know at that time. That said my, sample looked normal. And I still finished the course of antibiotics. And then after the course of antibiotics, I called the doctor back. I'm like, I don't think this UTI is gone. I think it's come back. Something's not, I'm still having a lot of pain. And so she sent me in for another sample. And again, it came back normal. There was no UTI. So all in all, with all of the blood work that I did, they found that I was positive with anti-nuclear antibodies, which is for autoimmune disorders. It wasn't a low positive, it was like, pretty number up there. And of course it can get higher and higher from what I've read, and I guess that was with all my symptoms. I started having like a psoriasis rash is what I guess it's called. I don't know. It was popping up on my leg, my thigh, my stomach, my scalp here, which I have been using T-Gel, Neutrogena's T-Gel shampoo, and that has helped a lot. So there was a rash it was popping up like little scaly rashes that was just on my legs, you know, and it was just not really itchy, but very scaly. Those are all things with autoimmune diseases, and there's so many autoimmune diseases out there. You probably, you know, then of course I have to see a rheumatologist for that, and then there's a million other blood work that will be performed to go down through the list to see which ones of autoimmune you've had. So there's that story with the autoimmune. Now after all of that, I went to see the dermatologist, or was it before? Either way, around that same time period, I went to see the dermatologist. She looked at the area and she said, I'm going to do a biopsy of this. She did rule out like Paget's syndrome, I believe it's what it's called. But she definitely wanted to do a biopsy. She was going to do a punch biopsy. So here is the story of the punch biopsy and my experience with the punch biopsy. So she numbed the area. She took a needle and she numbed the area. And pretty much they just take out some of your skin, like the top couple layers of the skin. Now the area where she did the punch biopsy was very confusing to me because it was away from the rash. It was above the rash. It wasn't actually directly in the rash. I don't know if she did that because it was already inflamed and she didn't want to maybe, you know, cause any issues. So the needle, you feel a little pinch, they go in a little bit deeper, and she said this is the part that usually hurts the worst. And honestly, it really wasn't that bad. Just lay there and breathe and you'll be fine. It takes 10 seconds maybe for them to numb the area, and that was perfectly fine. I barely felt it. I did not feel the biopsy itself done, the punch biopsy where they actually punched it out or removed the piece. It's a small little tiny piece that they removed, and then they will stitch up that area. I stitched mine up, they bandaged it up really well. I wasn't supposed to get it wet for about 24 hours. Unfortunately, I did get it wet, and it was fine. I made sure that it was dried and everything, but you're not supposed to get it wet for 24 hours. The first day, the first initial, once you have that numbing agent in you, you don't feel nothing. You are perfectly fine. You don't need to worry. It's not going to hurt you. But once that wears off, around 3 hours later is when mine wore off, I believe, and yeah, it started to pain. And the thing with this biopsy, the punch biopsy, I felt the pain lasted a lot longer than the core needle biopsy, which is another biopsy that I had done. Oh my gosh, I tell you, it's been some months, y'all. It's been some months. I am tired of going to doctors. Either way, so it's stitched up. She bandaged it up. I was supposed to leave it like that and then use a little bit of Vaseline if needed. They gave me steroid ointment, but I was not supposed to use that yet until this had like cleared up. So the first day, it's painful. It is painful. I did not take any pain medication for it, and I think my pain, I wanted to say I have a high tolerance for pain. I don't have a low tolerance for pain. But it was painful. The healing process, it was sore for quite a while. I would say 3 to 4 days it was sore, but it was not something that stopped me in my tracks, and I continued throughout the day and I was perfectly fine. And if it's really bad for you, just take some Tylenol, take some ibuprofen. What really helped me with the core biopsy was an ice pack. So I don't know, I don't remember them telling me anything about using an ice pack for the punch biopsy, but I guess because of the stitches, the pain lasted a lot longer than with the core needle biopsy. So the punch biopsy did not hurt. I didn't feel anything. When I came home, I didn't feel anything for a while, and the pain did start to kick in, and the pain lasted several days. But again, I did not take any over-the-counter pain medications for it at all. I was perfectly fine, and I managed to get through that. So it wasn't terrible, but it was definitely sore. It was an area I did not want it to be touched or anything like that. Then I had a appointment with my OB, my OBGYN, and then because I was all the cramps with the UTI and I was just cramping constantly, I went to my OB, and then we went over the rash. There was a lump on, so the rash was on my right side, the lump was on my left side. Okay? Yay me. So I went in for that. We talked about the cramping. Then I did an internal ultrasound, a TVU, and they saw that my endometrium was thickened. That is, I feel like I'm going all over the place. We're getting to the core needle biopsy, okay? So the punch needle biopsy, again, they go in, they numb the area, they take out that piece, they send it over to pathology and to the labs to do their report to see if it is cancerous, if it's what issue is it, right? So I went to my OB, and then they did the TVU, and they got the results back. They did not want to give me the results over the phone, so I had to wait. So I said I will go in, and I had a mammogram and an ultrasound scheduled so I had to go over to the hospital to get that done. They said that there was 4 cysts that they saw, and there was like what looked to be like a tumor or something that could be benign. They did not want to scare me, I believe. It could be like a fibroadenoma or something, but either way, they'd want to biopsy that to make sure. They have to biopsy it to make sure. So that was done, and then they called me a few days after, and they scheduled a biopsy, which was done at the hospital as well. This was going to be a core needle biopsy, so it's different than a punch biopsy. And so for the core needle biopsy, you go in. I went in very early in the morning to get this done. They usually do 1 per day at the hospital where I'm at, and they were super nice. The technicians there were super nice. The mammogram, the ultrasound, everything. I know people say mammograms can be scary and can be painful. It really honestly is not. If you need to get it done, don't worry about it being painful, because usually you can talk to your technicians and they'll tell you if it starts to hurt, you tell me when to stop. And I went in really early in the morning and got into the gown and everything like that. So I went into a room with the ultrasound, because it was an ultrasound guided biopsy, and they ultrasound the area, they marked the area, as well as with the punch biopsy. They labeled all around the rash, and then they marked and they punched exactly. So the same thing with the core biopsy. They marked the area that they were going to insert or do a small incision. So they did do a very small incision with the core biopsy, and the core biopsy was a little bit scarier than the punch biopsy, okay? The core biopsy, they're going to take a needle and they're going to numb the area, the general top of the area, and then they're going to take that needle and you're going to feel a little bit more pressure, and they're going to push that needle further down, and you're going to feel the needle going in, but it's already numb. So really all you're feeling is just like someone pushing on you. It is not really painful. It is just pressure that you're feeling. So they went in and they numbed all the way down. Okay, I am pausing this to first say sorry that I'm playing with my hair so much. And also, I did want to mention that they draped around the area that they were going to do the biopsy, and they cleaned it really well with soap, sudsy kind of soap. So they draped this blue kind of cloth all the way around and cleaned it really well with soap, and then they made the incision. Next, they told me that you're going to hear a loud popping or clicking sound or something like that, because the needle that they're using, it kind of sounds like a little gun that just pops every time, and you can see it go in and come out as it pulls some of that tissue out or whatever, yeah. So they went in and they did 3 samples of going in with the needle, and you would hear pop every time. And she warned me before each time she went in, she's like, okay, you're gonna hear the sound now. So it was like pop, and then go in, and I could see it on the ultrasound. It's going in a needle and then pulling out whatever it has to pull out. She did that 3 times, and they said if it looks fine by 3 times, if we have enough and our samples look enough, we won't do any more. But if it looks like we need a little bit more, they might go in another time or so. But 3 was good enough for them to get samples off of it. The core biopsy did not need any stitches. It put like a steri tape to hold that incision area together, and then they did bandage it up. Again, wasn't supposed to get it wet for 24 hours. And yeah, so again, I came home that day and I was fine. You're not supposed to lift anything heavy for a couple days, 2 days, I believe. You're not supposed to go in the pool or the hot tub or anything like that. Also with the punch biopsy, you're not supposed to go and, do anything strenuous or get it wet or sit in a hot tub, especially because it is stitches as well. But I actually felt really great after leaving the hospital. I went to Walmart, I picked up some groceries, and I was fine. I was doing great, man. I was great. But by 12 o'clock, they gave me some ice packs. They gave me 2 ice packs that I had to pop and shake, and it gets cold. And they use that for 20 minutes on and 20 minutes off, and use any Tylenol, Motrin, ibuprofen, whatever, as needed if you need to. Again, I don't really take over-the-counter pain medications unless it's really necessary. So I did not take anything, but I used those ice packs all day and all night, until I went to bed, obviously, but all day I used those ice packs. Not even 20 minutes on, 20 minutes. Well, I did do 20 minutes on, 20 minutes off because I had to put it back in the freezer to chill. But my gosh, once that numbing agent, the topical anesthesia wore off, it was painful. It was painful. But I got through it again. It just lay down, just rest, use those ice packs, because those ice packs helped me so insanely much. It's not even funny. I did not need any pain medication, but by the 2nd day, pain was almost pretty much completely gone. Now, I did have a lot of bruising, and the bruising is still there, actually, and so I lose my train of thought a lot. But I did have some bruising. But the ice packs helped so much. When I had the ice packs on, I could have done anything. I felt fine with the ice packs. It really took away a lot of the pain. It really helped with the pain management, those ice packs. I'm not even kidding you. Because without them, I don't know how I would have managed that day. But yes, if they do give you ice packs, use them. Use them. As soon as you feel a little bit of pain, get your ice pack going. Because I didn't at first. I waited like a whole hour, and I was paining, and I was just like, oh my gosh, I don't know. And I was like, you know what, let me go try the ice pack. And I did, and it was really, really helpful. So my first punch biopsy result came back. They say about 2 to 3 weeks, and it actually took a week for mine result to came back. That came back as pretty much inconclusive. I would say it's inconclusive because it came back as a hypersensitivity, and they lowered it down to being a drug-induced hypersensitivity or drug-induced something, essentially. And I'm like, I'm not taking any medications, y'all. Like, what they're like, if you have a doctor, talk to your doctor about whatever medications you're taking. And I'm like, I'm not taking any medications. I just take okay, my camera stopped recording. So I said, I'm not taking any medications. They're like, well, it could be a bug bite. I paid $500 for you to tell me it's a bug bite. I'm just kidding. It was a little bit like, really, bro? So, it was pretty much inconclusive because, and I say it's inconclusive because they said, let's stop everything that you're using for 1 month and see if the rash comes back. So I did. I stopped every single vitamin. I did not even take any collagen. I did not take anything. And I the rash came back. Lo and behold, the rash still came back. I used the steroid. I used the prescription steroid that she gave me, which was, she said 2 weeks on and 2 weeks off. So I had to use it twice a day for 2 weeks, and I used the steroid cream twice a day for 2 weeks straight. And let me tell you, the rash was still there while I was using the steroid. The rash did not go away. Now, I am a Christian, and if you're not, maybe this part isn't for you, but I am a Christian, and I do believe in the power of prayer. I do believe in healing. I do believe in miracles, and I have experienced that a lot in not only myself, but in my daughters, my children, when it comes to healing. And I do believe in the power of prayer, and I was prayed for, and actually I was sent a message that my pastor preached, and it had a quote, and I'm telling you, the rash is gone, y'all. No medication did it. Nothing helped that rash for about 6 months. That rash was there, and it never came back. No. I mean, glory to God. Praise the Lord. I don't even know how to explain it, because I tell you, it was torturous. Okay? I know it just seems like, oh, it's just a rash. No. If it was, whatever it was, if it was an allergy, because I was doing a lot of, research, and I did talk to a lot of people who had the same issue. If it was it's actually autoimmune progesterone dermatitis, which is a rash that appears on your cycle. That is not something that just goes away on its own. If it is an allergy related to, you're allergic pretty much to your own body, you're allergic to your own hormones, and regardless of what it is and what it was. If it is, autoimmune progesterone dermatitis, if you are dealing with something like that as well, that is something that is extremely rare. It's really, really rare, and I think it's being allergic to your own hormones. And there's no doctors that really know much about it. Some do, but not in my area. I did call around allergist specialists to see if I can do a allergy testing to see, and they're like, we don't do that kind of testing here. There's only one doctor that I know of that people actually send their blood work off to. But yeah, the same thing, all the symptoms, the muscle weakness, the joint pain, the brain fog, it's like every single thing I was feeling was associated with that rash. And that was also what all these other beautiful women who have gone through APD, autoimmune progesterone dermatitis, they experience all of those as well. Now, a lot of the symptoms, the brain fog, the muscle weakness, the joint pain, the fatigue, my goodness, the fatigue, wow, bro. Now, I heard one doctor said a long time ago, they don't believe in chronic fatigue syndrome. They need to talk to some patients with autoimmune disorders, okay? Because it's a reality check, bro. When you really get that fatigue, there's nothing, no amount of rest. I can wake up after 9 hours of sleeping and I'm exhausted. As soon as I get off that bed, I am exhausted. So, anywho, the punch biopsy came back as a hypersensitivity, which again was inconclusive because I stopped what they said to stop, and the rash came back. Also, the dermatologist said, come back in and we're going to do a second biopsy. Now, I talked to my OB, and my OB said, yes, go back in and do the second biopsy, because a lot of times if it is IBC or inflammatory breast cancer, it is usually missed the first biopsy. A lot of times it's missed the first biopsy around. They usually take about 4 biopsies around the area to really catch the IBC if it is inflammatory breast cancer. And honestly, again, it had all the symptoms of it as well. It had the skin feel, the skin was thickening, the area of the skin was thickening, so that was definitely concerning. The rash has disappeared and has never returned since. It's been months now and it has not come back, which is just by the grace of God. So my core needle biopsy results came back as a sclerosing adenosis, which is benign. Thank God it's benign. But it is something that increases a risk of breast cancer because breast cancer can actually grow around it or on it, and it can be missed because it looks so much like breast cancer on an ultrasound or on a mammogram. It has all the characteristics of breast cancer on imaging screens. A sclerosing adenosis, which is scarring and scar tissue in your milk glands. And it swells up and it causes a lot of pain. He's fine. What does he want? What does he want? So yeah, it causes a lot of pain, and that's actually why I did mention this to my doctor, because I had so much pain on my left side, down on my left arm, in my shoulder blade, in my back. The pain was intense. Now, my sclerosing adenosis is pretty big. Usually sclerosing adenosis is kind of small and you can miss it. You can't even feel it, but you can feel mine. Like, it feels like a legit mass, and it was seen as a suspicious mass, and they had to get that biopsied. And it caused a lot of pain. Like, my left arm would get numb. A lot of times I just kind of like have to squeeze my hand just to kind of get it going, and just, you know, and the pain, I tell you, I'm not even kidding. Before I even did the imaging test, because the imaging test was booked up for the hospital where I wanted to go. I didn't want to go too far. It was booked up for a month. So in that whole month time period, I thought I was having a heart attack, y'all. I'm not even joking. I thought I was having a heart attack. I didn't tell anybody this because I'm like, maybe I sprained a muscle. Maybe I hurt myself by lifting something heavy. And yeah, I can still feel that pain because it is a radiating pain that goes all the way down my arm, all the way down my back, all the way down my left side of my left chest area. And it is big and it causes a lot of pain. And so I do have a surgeon referral, but I don't think I'm going to do that, to have it surgically, you know, fixed or removed or whatever. They did go in with the core needle biopsy, and they did put a clip, a titanium clip, in the area, so anytime they have to go back and look at it or do another mammogram or ultrasound, they know exactly where they're looking. And if they already know that that area has already been biopsied. I should have probably said that while I was talking about the biopsy. So this went all over the place, but I guess it's just a story time. Now, when I did the TVU, the internal ultrasound, that showed a thickened endometrium, which is indicative of precancer of the uterus, apparently, or endometrial hyperplasia or something like that. Now, that may require another biopsy, which I am very, very, very hesitant to do. I don't want to do it because from everything that I've seen, from most things that I've seen and read and heard, it is extremely painful. And it's something that I don't really want to put myself through because I know that it's a blind biopsy. It's something that they go in and they remove parts of your uterus, the uterine lining, and it's done blindly. They're not seeing what they're doing. They're just pulling. And a lot of times, from what I've heard, they miss the actual area that is the problem. So you come back with a normal result and there can still be something there and you still have all of these symptoms. So I do have quite a lot of symptoms when it comes to that. I do have a lot of pain almost every single day. But again, I have so many things to do. I can't stay focused on pain. I can't let any kind of pain stop. You know what I mean? Like, I don't know. But I am going to start like hormone treatment to see if it can help. And as far as that goes right now, if that doesn't help or if it doesn't improve, or if I start to feel worse or anything like that, I will go back in, and they have other options as well. If I don't really want to do the biopsy, which, I mean, I don't really want to do the biopsy. I don't. The endometrial biopsy. If I have to do it, okay, maybe not. I mean, there are other options. There is a DNC with a hyperoscopy or something like that, where they take a camera, and it's not a blind biopsy at that point. They're seeing what they're doing. They know where they're looking at, and they know what they're getting. But we're going to try the hormones for now, and the hormone treatment, and see how that works. So that has been my story for the last several months. As far as the autoimmune issues, I am taking zinc every day. Well, not every day. I take zinc and probiotics, a lot live probiotics that I keep in the fridge. And you know, that's why I've been trying to clean up my diet, low sugar, low gluten, and a lot of autoimmune issues start in your gut. And by cleaning out your gut, by all those inflammatory foods, which is wheat, soy. I've cut soy out almost 100% on my diet. I've cut soy. I don't use soy sauce anymore. I just use coconut aminos. And I think that has helped a lot. And I'm really low in my carbs. I know, you all know I love my dinner rolls, y'all. I love my dinner rolls. My gosh, I love my dinner rolls. But I don't make as much bread as I used to. I don't eat as much sugar as I used to. Now, I still do bake. I still do make muffins and cupcakes and stuff, but I don't always have something sweet with my cup of coffee anymore. Especially like my chocolate chip cookies. That was like a daily thing I would have with my cup of coffee is my chocolate chip cookies. And all in all, it's been an experience, and I don't want to take my health for granted, because when you have a good day and you feel good, I mean, there's just so much to be thankful for in the world when you have, you know, your family around you and you have your children that you can just, you know, like I have my girls, and my family has been a huge support. I mean, so for the sclerosing adenosis, I also have what the radiologist said as extremely like dense, extreme density. Okay, let's just put it like that. Which is also has increased my risk of breast cancer, as well as the sclerosing adenosis also there has been like some conflicting studies, but it can increase your risk for breast cancer. So I will have to have like supplemental imaging done and stuff like that. That's as of right now. Have to continue talking to my doctor about it and see. But don't take anything for granted and lightly, because one small thing could turn into something bigger, and it's just by the grace of God. And I'm just so grateful. I'm grateful that I can be able to share this. I'm also grateful that I can, for strength to be able to make it through every day. I'm very, very grateful for that. The biopsies, they're not super bad. They're not super painful. The recovery is a little bit painful, but it can be managed. So if you do have a biopsy coming up, don't be afraid. It really isn't scary. That loud popping sound can be a little bit scary, but just know that when it's coming, it's coming. You know, they tell you, so it's not too bad. Yes, the endometrial biopsy or the DNC or the hysteroscopy, or I know I'm saying that wrong. Whatever, if that has to come up, if I do anything like that, right now I'm going to just try the hormone treatments, the hormones, and see if that, what it's supposed to do is help thin down the lining, so it can reverse if there is any precancer there. It can reverse that before it grows into cancer. And then if needed, you know, I will always call if it doesn't improve any of my symptoms. We'll probably do another video on that if that time comes, if I do go ahead and do those other procedures. I think it's a journey, and I'm hoping that this journey helps somebody, even though I know it was a journey that started here and it went here and went there and came back here and then went back over there and it came back here. If you know those memes, oh yeah, that's what this story time has been like. But I hope that it was helpful to somebody. I hope that if I hope that you don't even have to go through this, okay? Because it's just ain't fun, and it's expensive, okay? But yeah, I hope that you don't have to go through this, but if you do, it's manageable. You can get through it, and I hope that if you are going through it, leave me a comment, and I pray that I can encourage anybody or be supportive. So I'm grateful for the help and support and the advice and all of those things that was given by others. So I'm hoping that I can do the same for someone as well. And I know this is not a typical video of cooking or recipes or homeschooling, homemaking, but it is life. So there we go. Bye.